I am Nurse Ivy, and welcome to RN Nurse 411. Disclaimer: RN Nurse 411 is providing information to help patients, individuals, and families understand their health, healthcare, and the health systems better to be informed and in the know on making the best choices important to their health. This is not a platform that takes the place of seeking professional medical advice for a new and or ongoing condition that needs one-on-one care with a medical provider. Seek help immediately by a medical professional for immediate care or call 911 if it is an emergency. Just remember, if it's an emergency, stop what you're doing, pick up a phone, and call 911 and seek help immediately. Hi, I am Nurse Ivy, and welcome to RN Nurse 411. I am a registered nurse with experience in emergency nursing in the DFW Metroplex area. I noticed through my nursing career as a student and in practice that there is a huge gap in patients understanding their health, healthcare, and the healthcare system. What I want to do is my best in bridging that gap and provide the nuggets or gems of information that will help you, the patient, become a better informed and educated healthcare consumer in understanding your health and making the best choices that will allow you to enjoy your life. Welcome to RN Nurse 411. Today's episode: what's the big deal about getting a physical every year and how it can help me? Now, the only time I remember getting an annual physical growing up was at the start of the school year as a child. My mom always scheduled our physicals before the start of the school year to make sure our immunization records were up to date, and we saw the medical provider then. Now, fast forward to when I became an independent adult. An annual physical was not an item on my to-do list because I never knew it was needed. It was not until a coworker at my job pointed it out to me when I was signing up for health insurance, and it was an important thing to do since I will have health insurance. It was only then did I learn why it was so important to have an annual physical, and I'm so glad another person shared with me why it was so important. So now I am going to share it with you. The whole purpose of an annual physical is to have a good checkpoint on the record with your medical provider, who for anyone can be a doctor, a physician assistant, or a nurse practitioner, to make sure you're okay with your health. At your annual physical, your medical provider will ask you a lot of questions regarding your health history, family history, any stressors in your life like family, any unusual symptoms and moments experienced over the past year, like going to the emergency room, being admitted to the hospital, having a surgery, or seeing any specialist. All this information is important for your medical provider to know because it will allow him or her to customize and provide care based on your needs. The medical provider will also review your initial set of vital signs like your height, weight, blood pressure, respirations or breaths per minute, your pulse, your heart rate, and your temperature for a baseline set of vitals. This is just going to be the beginning starter point of your visit. And, vital signs are very important because it provides us with a quick picture of how you're doing at this moment in time of your visit. If one of these vital signs are not within normal range, please have no worries at first, because seeing a medical provider for anything can make people nervous and contribute to numbers being a little high or above normal, at which point in time your medical provider or their teammates will reassess you during your visit to make sure all is well. Next, your medical provider will do a physical assessment of listening to your heart, lungs, checking your eyes and ears, checking reflexes, feeling behind your ears, neck, throat, your stomach, and visually looking at your body from head to toe, what we like to call inspecting, just to make sure all is well. Medical providers do this to make sure you don't have any tenderness or pain in certain areas, and that what he or she feels, sees, and hears is normal. Then your medical provider will send you to the lab to have blood work done, like a CBC, which is known as a complete blood count, and a CMP, which is known as a complete metabolic panel. and urine specimen to make sure all is well with your health as well as the organ systems they represent based on your blood work. Your medical provider will also order specific tests, whether based on your conversation earlier at the beginning of your visit or because you have reached a special age group or bracket that may require additional testing, or there may be a concern about any chronic health needs. And I'll dig into that a little bit deeper. So, for example, your medical provider may also order specific tests like an A1C or a blood glucose. Now, what that does is that tests your blood sugar levels. If you're at risk for diabetes or maybe pre-diabetic or it's something in your family history, then that's something that they may look into, as well as maybe cholesterol levels. I think a CBC, CMP, blood glucose levels, your cholesterol levels are really good, along with your vital signs, are a really good starting point to monitor what I like to call your health IQ numbers. When the lab work is complete, the laboratory will send the information to your medical provider, who will review all this information along with the details of your examination during your annual physical visit and make sure there is nothing additional needed in your care. Now, this does bring up an important point all individuals need to be aware of, and that is age-appropriate preventative care screenings may be a part of your annual physical when age-appropriate, or based on findings during your visit. Like, for example, for women, they may have a pap smear or mammogram done. For men, they may have a prostate exam conducted. Or if you're in that category where your age is 45 and older, your doctor may recommend that you get a colonoscopy. So according to the healthcare.gov, it recommends talking with your medical provider about receiving preventative care screenings that should be at no additional cost to you through your insurance. And that's before meeting co-insurance and deductible requirements. Please review with your insurance company and or provider to learn more. There are about 21 preventative care screenings listed on the healthcare.gov website, and I will only highlight the most common and frequent ones that I've seen that I believe are important for individuals to be screened for early, because early intervention can improve your health and the quality and longevity of your life. The preventative health care screenings that I believe should always get checked at every visit, just because these are the most common things that I've come across: your blood pressure, know your cholesterol numbers, learn your blood glucose numbers to screen out for diabetes type 2, diet counseling, especially if your BMI is high or your body mass index is not within the normal range for your age and your height, colorectal cancer screening, which is your colonoscopy, alcohol misuse, depression screening, and depending upon your lifestyle, HIV screening, and then tobacco use screening. All of this information is really helpful for you, making sure that, one, a screening was conducted and you have a good snapshot in time of how your health is at this point in time for you and your medical provider to have a record of it. If something were to change, then your medical provider will have that history to review and will know how to care for you next and help you out as best as he or she can. Now, one of the things I really love and enjoy about my annual physical is that I have the same medical provider and team that takes care of me every year. So after my annual physical, if I feel unwell, sick, or actually needed to go to the emergency room for medical care, then I know that I can follow up with my medical provider, who knows me very well and will make sure that I'm okay and what I need to do next, if anything. I believe having and feeling like I have a great relationship with my medical provider is everything. I know when I feel sick and I call to make an appointment, my doctor already knows they can either squeeze me in, schedule me for an appointment sooner, see me the same day, or just send me to the lab to get work done and see what the results are based off of why I want to be seen, and take care of me that way instead of me going to the emergency room. And that's really important, because when your medical provider knows you and has history with you, they'll know how to take real good care of you. And yes, I do have a soapbox moment. The emergency room is not your regular medical provider. I repeat, the emergency room is not your regular medical provider. The emergency room is for patients on the edge of having a critical change or a change in their health status that requires immediate attention now. So when you go to the emergency room and do not meet that criteria and you're not seen immediately, a lot of people get frustrated and upset because they have to wait long periods of time to be seen and think that the medical providers and healthcare team do not care, and that is absolutely not true. The emergency department is organized based on critical care needs being met first, then all other things next. I know this sounds a bit horrible, but for someone who's worked in the emergency department and taking care of these patients, if your emergency is truly not an emergency, you will be seen as soon as someone can get to you. People get frustrated a lot of times because there's a long waiting period in the emergency room, but care is prioritized based on who's going to die in the next few minutes or hours if I don't touch them, who's going to be okay in the next few hours without collapsing, and who is okay to be seen after all those two categories have been taken care of and met. And so it's just really important for you to know that when you go to the emergency room. And truly, I get it. If something feels like an emergency to you and you don't understand what's going on and you need to be seen, then you need to be seen. But once again, if you understand your health and the health system, then you will be better guided on how to handle those situations when things don't feel right. This is why annual physicals are important, because once you establish a connection with a medical provider and they get to know you and what makes you tick, so to speak, they can help you when you're sick and care for you quickly and overall save you time and money. I would rather that you pay a copay, an appointment fee, than a huge emergency department fee for something that could have been a nasal swab or strep test at your doctor's office, instead of you taking 2 Tylenols and drinking it with apple juice and going home for something that could have been seen by your doctor. So here are a few takeaways to what's the big deal about getting a physical every year. It gives you a snapshot in time of your overall health. It keeps you in the know and informed on how to take care of yourself. It's an opportunity to take care of things that need your attention early and not ignore things before it is too late to do something about it. It allows you to establish a connection with a medical provider you prefer to care for you, and it allows you to be informed and in control of your health. You don't need to be an expert on healthcare matters. That's what the healthcare professionals are there for. However, you do need to be aware and in the know of what is normal and when something is not normal, and you need to take action and schedule an appointment with your medical provider that can make a difference in living the life you want to enjoy while you are here. That's it for today's episode of What's the Big Deal About Getting a Physical Every Year and how it can help me. All the best to your health.